People often confuse cataracts and glaucoma. Like, oh, I have glaucoma, or my mother had surgery for glaucoma. And if you dig a little deeper, you'll find out that it's not glaucoma, it's cataracts, which is much more common.
Welcome to Visionary Voices in Optometry, where we have real conversations about eye health, vision, and the role optometrists play in protecting overall health for Ontarians. Today's topic is cataracts, a leading cause of blindness worldwide. Despite how common they are, there's still a lot of confusion around them. How do you know when cataracts are affecting your vision? When is surgery actually necessary? What happens during the process? To break it all down, we're joined by Dr. David Black, a practicing optometrist and valued member of the Ontario Association of Optometrists. Let's get started. Dr. Black, thank you so much for joining us today.
Thanks for having me.
We're going to jump right in with a little introduction. So tell us a little bit about yourself and what inspired you to get into optometry.
It goes way back to when I was quite young, around 6 years old is when I got my first pair of glasses. And it also was helpful that my next door neighbor was my optometrist. And so my optometrist was also kind of like family to me. We were very close to this family growing up, and he inspired me and sort of mentored me as I got older. I was very interested in sciences and in eyes and eye health. And like I said, year after year, I kept having regular visits as my prescription got stronger and stronger. So that was a really early entry sort of into the optometric field, and it just took off from there. And actually, one of the offices I work at, I still work at that clinic with my next door neighbor and his son as well, who now runs the clinic.
Oh, very cool. So it's a bit of science and a little bit of relationship.
That's right.
Too,
yeah.
Right?
It's kind of, I call it a family business, even though I'm not a biological family, but they're like a family to me.
Excellent. So let's jump into the topic here today about cataracts, and we're going to go through a few different stages along the way here. So we're going to start talking about early stages first. And so what are some of the early signs of cataracts, and how do they start affecting daily life before patients fully realize what's actually happening with them?
So patients will typically start to first notice the signs of cataracts. One of the most common complaints or issues I'll hear from patients is that they need more light. They constantly walk into a room and they feel like they need lights to be on in order to see a little bit better. Often they'll complain of difficulty seeing when they're driving at nighttime. So those are the primary changes that they'll notice in early stages.
And so what are some of the common complaints, other than those two that patients mention, that make you suspect that they might have cataracts? Also,
if they just feel like they're not seeing things as well or as clearly as they used to, that additionally to those other points will be an indication. They feel like they say things just aren't as sharp as they used to be. They're not as clear as they used to be. And it can be sort of at all ranges of vision as opposed to just the distance or just the near vision. It's kind of like as a whole.
Right. So they just have a sense that there's something just not quite right?
Yeah.
So they're not sure exactly, right? So, okay. We're going to go on to detection now. And so how are cataracts detected during a routine eye exam? And can you walk us through the diagnosis process?
Sure. It's actually pretty straightforward because we can visualize the cataracts. The cataract is when the lens inside the patient's eye gets kind of cloudy and hazy, and it sits right behind the pupil. So we can sort of get a quick glimpse by looking at the patient's eye with some of our instruments, and we can get an even better look if we use drops to dilate the pupils, and then we can get a clear visual image with our instruments of the cataract inside the eye. Another way is often we'll take imaging of the back of the eye, of the retina, and of course to take those images, we are taking a picture through that lens of the eye. And if we notice that the quality of the images look kind of hazy or blurry, that's also a pretty good indication that the cataract is developing.
Okay. And can someone have cataracts and still feel like they're seeing reasonably well?
Definitely. I mean, a lot of it will depend on individuals' visual demands and what they're used to. And also because cataracts typically will develop very slowly and gradually. Often people may not necessarily notice the changes and feel that they are seeing well. So again, if they don't have any significant visual demands where they need to see a lot of details, then they may feel that they're seeing as well as they need to.
Right. Once cataracts are detected, how do you go about monitoring whether they're progressing?
So typically we'll make a documentation and a record sort of grading the degree of the cataract, where we may grade it just on a sort of a mild, moderate, or severe scale, or sometimes we'll use a 4-point scale, again, just to give us an idea of where we would subjectively categorize it. Also, when we're taking those images of the retina of the back of the eye, that's another way to sort of monitor it, if we can see the quality of those images over time. So sometimes I'll have a patient, we'll look and we'll say, okay, 3 years ago, our pictures were perfectly clear. And then last year, they were starting to have a little bit of haze or shadowing. And then on the more recent, we can see that the image quality of the pictures is degraded. And that's a sign that the cataract's getting worse.
Right. So you've mentioned taking images and technology a little bit, right? And so how has technology changed the way optometrists diagnose and track cataracts today?
I'd say primarily it's those retinal images, because we see the effects of the cataract on the quality of the pictures. But because we can see the cataract quite well on our own through a dilated pupil, we can visualize it. We don't need too much technology in order to diagnose cataracts.
Okay. And how often should someone with early cataracts have their eyes examined then?
If they're relatively early, typically once a year is more than enough to monitor the rate of the cataract progression. Cataracts, generally speaking, will progress at a fairly slow rate in people as they get older. If we do see that things are starting to progress, or the patient's visual acuity on the eye chart is declining a bit more rapidly, then we may want to watch them more closely on a 6-month basis.
Okay.
Oh, I was just going to say, and if we mention to patients that if they feel they're noticing further deterioration, always to book an appointment and come see us sooner.
Right. Okay. So you're working closely with them, sort of as the expert, but always look to the patient to keep an eye on the conditions, right? And if they see something changing, then they should flag that, right?
Yes, definitely. I mean, it's less critical in cataracts compared to some other conditions, because cataracts, it's not like a disease of the eye where if you don't catch it early, then you can have a poor outcome. So we're not, we want to monitor to make sure the patient's functioning comfortably and safely, but we're not really concerned about it from a health standpoint.
Okay, excellent. So that's a good segue into this next question then. So what are the biggest myths patients still have about cataracts?
Yeah, so just as I mentioned, one of the biggest myths is that people think that if they have a cataract, they have some type of eye disease. But I don't classify cataracts as an eye disease. It's more of a normal age-related change. Like I said, where the lens inside the eye comes kind of cloudy and hazy, doesn't let light to pass through clearly inside the eye. And I compare it to getting gray hair. I'll often tell the patients that, just you slowly develop some gray hair over time as you get older. Same thing, the lens inside the eye is going to gradually get kind of cloudy or hazy as you get older. So it's not a disease, nothing to lose sleep over. But just something to be aware of, this natural aging change that can affect the quality of the vision. And when it gets to the point where it's significantly impacting the visual quality, then they can have a surgery where that lens is removed from the eye and an artificial clear lens is inserted in its place. Another common misconception is people often confuse cataracts and glaucoma. So often patients will say, like, oh, I have glaucoma, or my mother had surgery for glaucoma. And if you dig a little deeper, you'll find out that it's not glaucoma, it's cataracts, which is much more common and much less concerning, where glaucoma is a true disease of the eye that can have as it progresses, ideally you want to slow that progression as much as possible, or initiate intervention sooner rather than later.
Right. Okay. How do you advise patients to decide when it's time to consider cataract surgery?
I use a few sort of markers or points that we look at in terms of when a patient would be a good time for them to have surgery. I'll tell the patients based on what their visual acuity is, meaning how well they can see on the eye chart. We use that as a gauge. Especially if they're driving, we know that there are certain limitations on what the patients must be able to see in order to maintain their license. So if they're driving and their vision is getting close to that limit, then we want them to be aware of that. Also, patient daily functionality. So I'll rely on their feedback and their input in terms of how much they feel it's impacting their day-to-day life. Are there certain things like, are they really troubled by night driving? Are they really uncomfortable? Are they unable to do certain of their daily living activities to the degree that they'd like to because they find their vision isn't adequate enough for that? And then the one other point is we'll look, like I said, we'll visualize the cataract, see how advanced it looks, and we'll take that into consideration too. For the most part, it doesn't matter the severity of the cataract, but we don't want it to get too dense, which can make a surgical removal more complex or complicated for the surgeon.
Okay, so let's move on to surgery then a little bit. So the sort of pre-surgery planning. And so patients, some patients, as they look into this, right, and they are informed, hear about several lens options before surgery. And so how do you assist the patient in deciding and understanding what's right for them?
Yeah, that's a tricky one because every patient is different and has different visual demands. And there's also a cost factor too in terms of their budget. So often I'll sort of start the conversation by saying, when you're choosing glasses, you have options for the type of lens that you put in your glasses. Do you want a multifocal lens so that pair of glasses can help you see at all ranges, or you just want a pair that are for distance or for near or have separate pairs? So similarly, when we're choosing a lens to implant inside the eye, the lens implants will have various abilities. Like I said, we can put a lens that will correct their distance vision optimally or their near vision optimally, or give them a multifocal to give a range. But some of these lenses also have certain pros and cons as well in terms of the quality of the vision. And one of the most talked about restrictions, I guess, on some of the lenses is if we talk about multifocal lenses that give patients the ability to see far and near, we know one of the common side effects is that they have a greater chance to create effects of glare or halos from sources of light, especially when night driving, and that could be problematic for people, especially if they do a lot of night driving. So we get a sense of what the patient's lifestyle's like and what demands and what their goals are, and then we can help guide them in terms of what would be either the best lens option for them, or at least things they should consider when making that choice for lens.
The pathway then to surgery itself, what's the difference between having cataracts and actually needing to have the surgery?
So, like I said, cataracts is kind of on a spectrum where you can have early or a little bit of cataracts where the lens in the eye just starts to become a little bit cloudy, a little hazy, but it's not really impacting the patient too significantly. But again, when it gets to the point where it's either a safety issue or the patient is just unhappy with the quality of their vision, then that's where we would start the process by referring the patient to a cataract surgeon for a consultation to discuss, again, what's exactly involved in the surgery, the lens options, and then to determine if they're ready to go ahead with the surgery itself.
So the role that the optometrist plays in advance of the surgery sounds like there's a lot of the consultative piece with the patients, right?
Definitely. We want patients to understand, because it is a complex issue, to have at least a general sense of what to expect with the surgery and what options will be proposed to them. And then I also offer my patients, I say, hey, after you have your consultation, if there's any questions, anything you're confused about, feel free to reach out to me and I can help further explain some of those things to you. There's also some great resources on the internet that I'll guide them to as well to find out more information about the surgery and the lens options.
Right. And then once the surgery is done, what's the ongoing role that an optometrist plays?
So after the surgery, typically the surgeon will see them a day after the surgery. Other surgeons may or may not see them a week after, but typically somewhere between 3 to 4 weeks after the surgery. The patient will come back to the optometrist where we will check on how everything is healing, how the eye is recovering, and we'll check their refractive status, which means what is their current prescription. And in some cases, the goal may be that they don't have any prescription, so we want to see that it's hopefully there or close to that. Or if the outcome, say, was for distance vision, then we can help get them set up, find out what their appropriate near vision correction would be for glasses at that point.
Are there certain lifestyle factors or health conditions that can cause cataracts to develop earlier?
So in addition to aging, one of the key factors for cataract development is UV exposure, UV radiation from the sun. So we try and really instill in our patients that from a young age, important to be protecting the eyes from UV rays from the sun. You want to have a good pair of UV protecting sunglasses because it's the cumulative effects of the UV that will hasten the development of cataracts. Additionally, certain certain health conditions like diabetes will also increase the risk of developing cataracts from a younger age. So maintaining good general health, blood sugar control in diabetics, or diet and exercise to prevent from becoming diabetic is important as well. We also want people to be mindful if they take any medications that have steroids in them, whether they're topical eye drops or if they're taking orally. We do know that steroids can increase the risk for early development of cataracts.
So if people look after their eyes, be careful about UV as an example. Does it help protect their vision from cataracts or their eyes from developing cataracts, or is it something that's just it's going to happen?
It can delay it. So cataracts typically are going to happen with age regardless, but the UV radiation can hasten or quicken the pace of the cataract development.
What's the general rate of success with the treatment of patients?
The success rate is extremely high. Patients generally do really well. They can see really well, especially when patients have gotten to the point where their cataract is really impacting the vision. They really see a big difference in the vision afterwards. So it is pretty routine. I mean, I think it's one of the most commonly performed surgeries. And it is surgery, and when you see so many people having surgery, there are certain complications that can arise. Luckily, most of them are pretty minor complications, things like some soreness or irritation after surgery, which in most cases resolves on its own, but sometimes needs additional therapies or treatments. So I want patients to know that although it is a relatively straightforward surgery, it is surgery. And whenever you're doing surgery, there's no guarantees on the outcome. So something it's very important to know going in.
And then once you have to have the surgery, there's a lot of consultation, the surgery itself, and then there's very sound follow-up as well on behalf of the folks that look after the patient, right? And so people are in good hands.
Yes.
Ultimately,
most certainly. Right? Between the surgeons and the optometrists who are referring them to the surgeons, they have lots of people that are managing their care and sharing their care. So usually there's no issues in having the proper people look after you.
Right.
Patients can, when they first hear the word cataract, can feel very overwhelmed. And I guess the 2 points I would want to make on that is that, number one, cataracts, it's not an eye disease. It's a natural aging process. So nothing to be worried about, nothing to be overly concerned. And the second thing is that it can also be overwhelming because with all the new technologies and options, again, trying to make sort of certain decisions or know which way to go can be a little difficult. And just remember, your optometrist is there to help guide you through the process. And they have a wealth of knowledge to help. And if you've been seeing them for a while and they know you a bit on a personal level, then they can even better help guide you through that process.
Right. Okay, perfect. So just to wrap up then, what's one piece of advice you'd give someone trying to protect their vision as they age?
To protect your vision as you age, I mean, the key things for me, well, number one would be make sure you're seeing your optometrist regularly for comprehensive eye examinations. We can really, through early detection of eye diseases or disorders, we can prevent or at least delay complications or vision loss. So it's important to go ideally once a year. And protect the eyes from UV radiation, wear UV protecting sunglasses, and general, taking care of your body health through diet and exercise is going to help your eyes as well.
Excellent. Dr. Black, thank you so much for joining us today. It was very informative, and certainly hope that everybody listening and watching will leave this episode feeling very safe, knowing that they're in good hands with you and all the other optometrists in the province. So thank you so much for joining.
I hope so as well. Thank you very much for having me. This was a lot of fun.
Excellent. Thanks very much.
Thanks.
Cataracts are very common with age, but with regular eye exams and early detection, there are clear steps patients can take to manage their vision and know when to act. If you haven't had an eye exam recently, this is your reminder. Your vision matters, and so does your long-term eye health. Thank you for joining us. If you find this episode informative, like, share, and stay tuned for another Visionary Voices in Optometry.